Hi, I'm showing a diagnostic arthroscopy. So this is inside your shoulder joint. On the right you can see the socket and on the left side is the ball. Now what you can see here is around this ball and socket are the ligaments that hold the joint together. There is a loose body there which you could see like that tiny dot. This is the torn ligaments in the front of the socket which have come off and which will be repairing in this procedure. So normally these torn ligaments which you saw there should be attached to the socket. And then this is the ball. There is a defect which we can see on the back side of the ball. That's what we call as a Hill-Sachs lesion. Again, this is the Hill-Sachs lesion which you can appreciate. There is the biceps tendon on the top at about 1 o'clock position.